Hello, my name's Callum Robertson. I am a pathology registrar in the Queen Elizabeth Hospital in Glasgow. Uh, this is the first in a series of presentations that I'm about to give, which the aim of which is to cover the basics in pathology, a kind of very basic level introduction aimed at new registrars who've just started, who perhaps haven't seen a histology slide in a number of years. Some of us got varying degrees of histology teaching in medical school, but for most of us who start in pathology, that is in the dim and distant past. And so it is really probably quite helpful to have a quick run through of the basics, the basic principles of histology, looking at H&E slides. Some of which will be revision and some of which will be new to give a foundation before you start reviewing live slides and teaching cases with consultants. So for here in the screen in front of you, we've got a section of skin here, which I'm just going to use as an example slide. We'll talk more in detail about skin itself in a future video. But this is just an example. So here we're looking at a scan slide. So pathology has been around for around a century or slightly under. For the vast majority of that time, this has involved looking down a microscope. Over the last few years, we've started a slow transition into digital pathology, where I think eventually it will all diagnostic slides will be scanned, and we'll be viewing them in this way. But for now, we still use microscopes. And this is just exactly what you'd see down a microscope, except it's just the scanned version. Here we're looking at this at the slide at low power. Now we talk about low power and high power as a synonym for zoom. So if you're zoomed in, it's high power. If you're zoomed out, it's low power. And digital pathology is a bit more fluid. You can zoom right in, you can zoom right out, and anything in between. But in microscopes, you're sort of limited by the lenses at your disposal. Usually there's a ×2 lens, a ×4 lens. These are the low power lenses that you can select. So you're zoomed out. There's ×40 and ×20, which are high power when you're zoomed right in. And then ×10, which is sort of, thereabouts, somewhere in between. Actually, as might be obvious to you, ×2 is not actually ×2. We're not actually looking at things twice as big as they are in real life. That would be a bit mad. You can't see cells just because you look at the things on 2 times magnification. Everything is actually 10 times more than it says. So ×2 is actually ×20, ×4 is ×40, ×40 is actually ×400, and that's because there's actually a ×10 magnification lens behind your eyepieces in your microscopes. But out of convention, we talk about ×2, even though it's actually in real life ×20. So the vast majority of our work will look like this. We use light microscopy for pathologists use light microscopy for the vast majority of their diagnostic work, and we look at an H&E stained section. So this is hematoxylin and eosin stain section on a formalin fixed paraffin embedded H&E stained slide. So that is to say that the tissue has been fixed in formalin. That's to sort of kill it, essentially, and preserve it so that it doesn't degrade. And it's then after that, it goes under, there's a number of processing stages which culminate in a tissue section, which has been fixed and then is embedded in wax. So it's paraffin embedded. And after that, a tiny slither of tissue, 4 microns. Microns is another name for a micrometer. Thick section is cut, and that is stained with whatever you want to stain it with. In the vast majority of cases, it's hematoxylin and eosin or H&E, and that's what we're looking at here. So H&E or hematoxylin and eosin is a sort of over 100-year-old technique, which we still use unbelievably for the vast majority of our diagnostic work. Hematoxylin is the first stain that's used, and that stains nuclear material, actually stains acids, but nuclear material is mostly acidic. So if we look at a cell here, you can pick any of these cells. The blue stuff here, or here, there's round blue stuff. These are the nuclei, and they've been stained by hematoxylin. And this hematoxylin stains the nuclear material blue. After that, we use an eosin counter stain, and eosin stains everything else pink. So it actually stains bases pink and proteins pink. So all the pink stuff is being stained by eosin, and that stains largely the material that's not within the nucleus. So it'll stain the cell cytoplasm and the extracellular material pink, and various shades of pink. And that is all that we see here. Well, all the varied appearances of all the cell types and tissue types are all a result of just these two simple stains, which have been around for over a century. And through these, the combination of these stains, we can diagnose the vast majority of the conditions and the vast majority of situations. All that is required for diagnosis is an H&E stain slide. We can use adjunct tests, which could be split into either histochemistry, or we kind of call special stains, where you use another stain that's not H&E, and you can use, for example, a PAS is probably the most commonly used one, which we can use to show, for example, fungal organisms stained with PAS. In skin, we use that a lot. And we can use other stains. For example, we might use a Congo red stain to stain for amyloid, or we might use a pearl stain to stain for iron. There's lots of different stains we can use, although we don't do that in the majority of cases. More commonly, we use our other main adjunct test, which is immunohistochemistry. Immunohistochemistry is not, as opposed to histochemistry, is a immunological-based technique, an antibody-based technique, where we use antibodies to stain, to highlight a specific protein that we wish to show is either there or not there. And they can be nuclear stains, they can be cytoplasmic stains, they can be membranous stains. It's out with the remit of this particular video to go into that. You'll see that when you start looking at diagnostic slides. But suffice it to say, immunohistochemistry, or immuno, or IHC, is the main adjunct test that we use in a variety of different situations. But right now we'll just stick with the H&E. So we can use H&E to look at a variety of different tissue types. The main tissue types within the body, as you remember or not remember from medical school, you've got the epithelia, or the epithelial tissue, or epithelium. Epithelium is kind of characterized by its ability, the cell's ability to stick to each other, to stick together. Here we've got lots of epithelium we can look at. So there's main two types of epithelium, is squamous epithelium and glandular epithelium. We'll look at squamous first. So if we zoom in a little bit here, this is the epidermis. We'll go into the skin in a later video, the specific points of skin, but suffice it to say that this stuff here is epidermis. So this is squamous epithelium, which it's actually stratified squamous epithelium. So that means that stratified means it's got multiple layers on top of each other. So it's not just one cell layer thick, it's multiple layers. So that's stratified epithelium, and this is squamous epithelium, which is a type of epithelium that generally is used as a barrier. The cells tightly adhere to one another, and you can actually see here, if we look closely, you can see these little intercellular bridges, these little spikes here. These are the intercellular bridges that connect the adjacent cells to one another. And So this is squamous epithelium, and this is stratified squamous epithelium, and this is actually keratinizing stratified squamous epithelium. So at the top here, you can see keratin. So this is keratinizing, and that's the type of epithelium you get on the skin. So along the bottom here, you've got the basal layer, and these are the cells that are replicating. We're going to go into this in more detail later, but these are the cells that are replicating, and they mature upwards, and slowly the nuclei die off, and here you can see in purple the keratohyalin granules, which uh, form the basis for the keratin that you can see on the surface here. And that's happening all the time. These cells are replicating, maturing upwards, and getting shed off. Uh, and that's squamous epithelium. We've got another type of epithelium here, which is the other type is glandular epithelium. There are different types of that, but here, if we look down here, these are sweat glands, and these are made of glandular epithelium. Which is different from squamous epithelium. The purpose of glandular epithelium is not protective, it's not to form a barrier, but it's usually they produce things. Glands produce things, where in this case, they're producing the kind of sweat secretions. This is a different type of glandular epithelium here. These are the sebaceous glands, and they're producing sebum, which is the oily stuff that gets secreted from sebaceous glands that you can see on your skin surface. This is probably from someone's face because it's got, or head and neck, quite a lot of sebaceous glands here, which we wouldn't see, for example, in somewhere like the forearm. So these are two different types of glandular epithelium. Now, glandular epithelium can be simple if there's only if it's only got one cell layer, or it can be pseudostratified if it looks like there are multiple cell layers, or it can be stratified if there are actually multiple cell layers. This is probably is stratified because we've got probably here's one cell on top of the other. Stratified glandular epithelium. And that's probably all I'll say about that for the moment. We'll go into this in further detail as we go through the slides. So they are epithelial tissues. To recap, the main two types, squamous and glandular. So the other main, another main type of cell you get is blood constituent cells, amongst which there are inflammatory cells. Let's look at one type of blood constituent cells. Here's a blood vessel. Here's another blood vessel. And the main cell type is a bit blurry here. I wonder if we can find a better, less blurrier example somewhere. It's been scanned. Don't seem to be able to find that. Perhaps we can see some here. Yeah, wee bit blurry. Anyway, these red cells that are taking up a lot of the eosin stain are actually erythrocytes, or red blood cells. They're just taking up eosins, so they're not taking up hematoxylin, and that's because they have no nuclear material. They're just all cytoplasm, so they're essentially a dead cell. That's just a peculiarity of mature erythrocytes. All other viable cells will have a nucleus, but erythrocytes don't. And they have this kind of unique concave shape. They're quite distinctive. If a cell doesn't have a nucleus, it's just all eosin, and it has that concave shape. This is quite good. You can see the side on. You can see the concave appearance of it. That's you can see this as kind of this almost looks 3D. This one you can see the concave appearance of this. That's a little hollow in the middle there of that cell. So we see them in all sorts of different orientations, but these are all erythrocytes. And I know that because they're just taking up eosin. They have that concave appearance, and they're not taking up hematoxylin. There's no nuclei. Also, it's helpful. You can see them inside a blood vessel, and they're abundant. And they're the kind of unsung hero of pathology because you see them everywhere, but you tend to just ignore them. Most of the time, we don't really care about erythrocytes. There's not many diagnoses that require paying attention to erythrocytes. There are occasionally times where you might see erythrocytes outside of a blood vessel, so-called extravasation of red blood cells, and that's sometimes important in some conditions. But in general, we tend to just accept that they're there and ignore them for the most part. So that's the main type cell type within blood, but it's probably the one we care about least. Let's talk about a different blood constituent cell, an inflammatory cell called a lymphocyte. So lymphocytes are the inflammatory cell that you will see most in histological sections. These are cells which are part of the chronic inflammatory response. They're also present, to be honest, in pretty much all sections. You'll see lymphocytes somewhere, they're really abundant. They're the one, if you remember from your full blood count, lymphocytes are the most numerous in blood, and you see them everywhere in histological sections as well. Here, we've got lots of lymphocytes in this particular view, and you can identify lymphocytes on histological sections because they're almost all nucleus, in contrast to erythrocytes, which there was no nucleus. The lymphocytes are almost all nucleus. There is some cytoplasm within these cells, but on cytological preparations, you can sometimes see a little bit of cytoplasm, but on H&E tissue sections, you almost never see it. So the lymphocytes are, in this section, these inky black dots, or inky purple dots, because here's one here that I'm outlining, and here's another one, and there's another one, and here's another one, and there's more, but lots of lymphocytes, and they're identified by their inky purple nucleus with almost no cytoplasm round about it, and that's the lymphocyte. There's not really much to say about lymphocytes. They are part of the chronic inflammatory response, and so lots of lymphocytes indicate chronic inflammation. Lymphocytes indicate chronic inflammation, so if you have an increase in chronic inflammation, you'll see a lot of lymphocytes, or rather, if you see a lot of lymphocytes, that indicates there is an increase in chronic inflammation. So that's lymphocytes. Really, you'll see them on all sorts of tissue sections, and they're one of the easiest things to identify because not much else really looks like a lymphocyte. But this section, we can see some more lymphocytes here, inky purple dots, but there's another type of chronic inflammatory cell, which is very common to see and is diagnostically very useful in a lot of circumstances. It's going to be a wee bit difficult to show the finer points of this because it's a wee bit blurry, but let's have a go anyway. So amongst all these inky purple dots, there are bigger cells. This is one here, and 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 this is one here. So these are cells that are also part of the chronic inflammatory response, but they're not lymphocytes. These are plasma cells, and they're different from lymphocytes because their nuclei look a bit different. Here, instead of an inky purple dot, we've got these little clumps around the edge of the nucleus of chromatin that are taking up the purple eosin stain, giving it a clock face almost appearance. So this is if it's got a clock face appearance, an inflammatory cell, but instead of like these lymphocytes that have hardly any cytoplasm or none to see at all, this has got quite a lot of cytoplasm around about it, and you can see that it's cytoplasm because it's picking up the eosin stain, and it looks pink. So that's cytoplasm of this cell. That's the nucleus with its clock-faced nucleus, and this is the cytoplasm. And right next to the nucleus, there's a kind of more intensely pink bit. It's not just in this cell. This one has it as well. An intensely pink bit just right beside the nucleus. Here's another example. You've got the nucleus here, an intensely pink bit within the cytoplasm, then a bit more cytoplasm round about it. And that intense pink staining is staining up the Golgi apparatus of this cell. And it's so-called a perinuclear HOF. And that's because this cell, the eosin stains proteins pink. This is loads of proteins. So this is loads of immunoglobulin. And that's because this cell is a plasma cell which is and its purpose, its job, its purpose in life is to produce immunoglobulin. So these produce antibodies. These are plasma cells producing antibodies. And they always have that look. They always have this clock-face nucleus, this perinuclear pink HOF, and they're busy producing immunoglobulin. So that's a plasma cell. And you see them quite often in tissue sections of various types. And they can be very useful in that a lot of diagnoses can hang on your observation of plasma cells. They're a useful thing to be able to identify. So we've identified red blood cells, lymphocytes, plasma cells. The next thing we should look for is we should look for another inflammatory cell, which is not part of the chronic inflammatory cell group. It is an inflammatory cell called a neutrophil, which signifies acute inflammation. So neutrophils are basically synonymous with acute inflammation. If you see neutrophils, there's some degree of acute inflammation going on. And there are no other cells that mark acute inflammation, and neutrophils don't signify chronic inflammation, so they're quite specific for acute inflammation. So a really useful thing to see. And neutrophils go also by the name of neutrophil polymorph, but we commonly call them neutrophils, and they're easily identified by their 3-lobe nucleus. I'm trying to find a good example. There are some neutrophils in here, but I'm trying to find a good example of one. And what I'll do is I'll come back to this in a second with an example of a better example of a neutrophil. But what we're looking for in a neutrophil is the 3-lobed nucleus, and that's how you know. It looks a bit like a Mickey Mouse. And let's see if we can. I'm going to come back to that. The other main inflammatory cell is a macrophage. So a macrophage is a big eater. Basically, that's what it means. Name means. It's part of the antigen presenting system. So they gobble up antigens and present them to your other cells of the your lymphocytes, for example, and your other immune cells. So I'm trying to find a macrophage. So macrophages are part of the monocyte macrophage lineage, and they are called macrophages when they're in a fluid or in blood, but they've got a different name when they're in tissue. Another name for them is a histiocyte. That's when they're in tissue. So histio means tissue, and so if it's the cell of tissue, once it goes into tissue, it's called a histiocyte. When it's in blood, or when it's in a fluid, we call it a macrophage. Here's I found a neutrophil here. So here's a neutrophil, and this neutrophil is not signifying acute inflammation because it's actually still within a blood vessel. But here's a neutrophil. You can see it's 3 lobes. This is a bit blurry, but you can see this is the nuclear material. Because it's purple, it's taking up eosin, and it's got 3 lobes here. So those 3 lobes signify that is a neutrophil, and it looks a little bit like Mickey Mouse. So you've got the head here and the 2 ears, surrounded by its pink cytoplasm, and that was how I can tell that's a neutrophil. We'll find better examples of neutrophils. I haven't seen a macrophage or a histiocyte. This may be one. It may not be, but this signifies what a macrophage often looks like. So you've got a nucleus here, and you've got this kind of frothy cytoplasm round about it, and that's what a macrophage often looks like. I'm not saying that this is one, it may not be, but it's a good example of what a macrophage looks like. And there's a collection of chronic inflammation here, including lymphocytes and plasma cells. It's not out with the realms of possibility that a macrophage might accompany that, or a histiocyte, because it's in a tissue section. And they're the main cells. So we've covered erythrocytes, lymphocytes, neutrophils, plasma cells, and macrophages. And we'll drum that in further. We'll come back to these further in future videos. That covers the main inflammatory cells. So the next group of next tissue type or group of cells I want to talk about are muscle cells. So you get 3 main types. You've got smooth muscle cells, skeletal muscle cells, and The third type is cardiac muscle. Cardiac muscle is quite specialized. You won't really see it very much at all in your diagnostic practice. The main time you'll come across it is in autopsy pathology, to be honest. And I don't have any cardiac tissue here to show you, so we're going to cover the main two types that you're going to see day in, day out, which is smooth muscle cells and skeletal muscle cells. So smooth muscle cells, we're in the skin here, so smooth muscle cells, the main place you'll see them is in the walls of blood vessels, or sometimes you can see them if you've got a good section in the erector pili muscle, which is responsible, is associated with hair shafts and is responsible for bringing the hair shaft from the kind of more horizontal position where it's lying in line with the skin to the upright position, which you can do in response to being cold, for example. And here is some erector pili muscle. So this is made of smooth muscle cells. This is not the best example, but so we'll maybe come across others when we scoot around. But a smooth muscle cell has an elongated nucleus like this, like this one here, like this here, and bright pink cytoplasm round about it. The nucleus is placed right in the middle of the cell, and the cytoplasm is round about it. Let's see if we can find, so the other place you can find smooth muscle is around blood vessels, specifically around blood vessels of the arterial tree, because veins are thinner walled and you won't see the muscle around them in the same way. Here, I think we'll cover this later on when we go to a section of a GI section. Okay, so this is the other main type of muscle called skeletal muscle or striated muscle. So here we're in the face. This is skin of the face. So we've got the epidermis up here, and this is the dermis, this is the subcutaneous fat, and underneath that we've got a bit of skeletal muscle, which might be skeletal muscle that forms part of the facial facial skeletal muscle that's responsible for facial expressions, etc. So we've got a little bit, just a few cells here, skeletal muscle, but it illustrates quite nicely the main points, the skeletal muscle. So it's also called striated muscles because of the cross striations. So here's a muscle cell, and you can see that kind of striated appearance. So it's like lines. The myofibrils are in a linear distribution, and you can see the cross striations going this way. So it's like got a kind of fibrils going this way, and then the kind of cross striations crossing its path, going perpendicular. And that's a nice example of striated muscle. So that's the cytoplasm of striated muscle. That's the bit that does the constricting effort. But like all viable cells, they have nuclei, but in the nuclei of skeletal muscle are always pushed out to the edge. So if you look to the edge of this big myofibril, you'll see the nucleus out here on the edge, this inky purple nucleus. And it's the same here, it's the same here and here and here, and that's what skeletal muscle looks like. There really is very little to say about that. Skeletal muscle is one of those things that doesn't really cause as much problem as in pathology, occasionally does, but most of the time we just ignore it. And we'll cover smooth muscle, and when we see a GI biopsy, we'll see a bit more of a better example of that. The next main tissue type that I'm going to cover is neural tissue. The most our biggest interaction in pathology, in general pathology, with neural tissue is through nerves in tissue sections. And here is a really good example of a nerve. So nerves all have this look. So this is the nerve here, and we're just seeing a cross section of nerves, which you can see these little circular areas. Here, here. These are eosin stains. So this is the cytoplasm of the cells, and that's when you see what we're seeing here is an axon that we've cut through. So these are the axons of the neurons that we've cut through. Sometimes you cut through them in an oblique way, in which case they look a bit more wavy. So that's this axon's kind of coming up this way. So if you cut through the section of an axon, a cross section, you'll see a circular appearance. If you cut through it in an oblique way, you'll see this wavy appearance. But it's just a different way of looking at the same thing. These are axons, and this is a nerve. Within the nerve, you can also see these nucleated cells. These are not the nuclei of neurons. We shouldn't really see them within a nerve. Within the nerve, you'll just see the axons. When you're in a tissue section, the neurons are elsewhere. But these are nucleated cells. These are viable cells, but they're not axons. They're not part of the neurons. These are Schwann cells. So these are Schwann cells. The cells are responsible for maintaining myelin, and that's what a nerve looks like. The nerves are surrounded by perineurium, and that's what this looks like. That's what this denser pink stuff is round about it. And all nerves look like this. They might be smaller like this. They might be bigger like this. You can get much bigger nerves, which we haven't got in this tissue section. Here's another nerve right out here we're seeing a nice section of, surrounded by the perineurium. Again, our axons, again our Schwann cells in the middle. And that's I don't think there's much more to say about neurons and about nerves than that, other than to say that often you see nerves hanging about with their buddies, the vein and the artery. Here's probably an example of that. Here's a nerve and here's a vein, and that's maybe a wee arteriole. They hang about together often and when you see one, you'll often see the other round about it. Vein, artery, and nerve running together. But this is a 2D section through a 3D structure, so it's always useful to keep that in mind when you're looking at anything really. And the here, for example, we've got a nerve out on its own. There probably is a vein and an artery associated with this, but we're just not seeing it in this plane of section. Okay, we've pretty much covered most of it now. The only last thing really to cover is the stuff in between all this other stuff. So we've covered the epithelium, the squamous epithelium, the glandular epithelium. This is a hair follicle actually, which is a modified form of squamous epithelium. This is glandular epithelium. But between all of this stuff, between the nerves and the squamous epithelium and the glandular epithelium and then the blood vessels, is the connective tissue. And this is connective tissue. There's different types of connective tissue. So here we've got fat. That's a type of connective tissue, and it always looks white because these are adipocytes. The white bit is within the adipocytes is the fat, and that's been cleared out because we use alcohol as part of the processing of these. Part of the processing of getting from tissue to paraffin embedded block. We use alcohol as part of that process, and to dehydrate the specimens. And alcohol removes fat, it dissolves the fat, so there's nothing left. It just leaves these empty holes that would have once contained fat. And these are each one of these holes is an adipocyte. You can see the nuclei of the adipocyte, which are pushed out to the edge, and the cytoplasm is just replaced. Well, it's not replaced really, it's just empty now. It's just in a hollow empty space. And adipocytes just look like they have this look. So most of now you've got your eye in for that, you can see there's adipocytes everywhere. There's fat everywhere. There's another adipocyte with a nucleus out to the side and the empty cytoplasm. And there's lots of fat here. So that's one type of connective tissue called adipose tissue, made of adipocytes. It's just fat. The other main connective tissue type that we've got here is this stuff. So this is within the dermis, and the dermis is made of this stuff, which is actually dead tissue, really, because it's not nucleated tissue. It's not a cell really here. This is collagen. So the collagen is a protein, and it takes up that intense pink eosin staining. And there's no nucleus associated with this. This is a collagen fibril. These are more collagen fibrils here. And collagen is not intracellular, it's extracellular material. It's maintained by cells, but it's not within a cell. It's not living tissue per se itself. And that's collagen. And there are different types of collagen. This is type 1 collagen because it's within skin. There's type 2 collagen, which is in the main type of cartilage. Type 3, which is reticulin, which forms networks, for example, in the liver and within lymphoid tissue. And there's type 4 collagen, which you get within basement membranes. So you get a basement membrane at the bottom of epithelium. So basement membrane running down here, that'll be type 4 collagen. There'll be there are other basement membranes. There'll be 8 basement membranes within this blood vessel as well, underneath the endothelium lines the surface, and that'll be type 4 collagen. So there's different types of collagen. There's another main type of tissue here, which is elastin. You get elastin fibers, which stain. Here's elastin fibers. These are the collagen fibers, because I can tell that because these are bright pink. But these are elastin fibers because these are lighter pink. These are an elastin fiber there, and the tissue, the skin has an elastic capacity, and that's because of the elastin fibers. So you've got a mixture of collagen and elastin in here, and between that there'll be other stuff, so-called the ground substance with made of hyaluronic acid and all sorts of other things that to be honest I can't really remember, but that forms the ground substance. So that's the stuff between cells, and we really don't worry about that too much, to be honest. But I mentioned that the collagen will be maintained by cells, and the cells that maintain this collagen are these cells. So we've got like little nuclei here and here and here, little elongated cells that have the cells that taper from one end. See, it's like a fat in the middle, and it'll taper to this end and it'll taper down to that end. So, and we call that a spindle shape or a fusiform shape. Because it tapers to one end and tapers to the other end, and all these cells are doing that, and that's because these are fibroblasts, and fibroblasts are part of the connective tissue. They're a connective tissue cell, and they help maintain this extracellular matrix here. You'll see fibroblasts in all sorts of tissue types, and that's what their job is, to just maintain extracellular tissue. So really, that pretty much covers most things. One thing I haven't covered so far probably is blood vessels themselves. So let's just zoom in here and have a wee look at some blood vessels. So blood vessels, you get different types of blood vessels. You get arterioles or arteries. They're all part of the arterial tree that takes blood, oxygenated blood from the heart to tissues. And you can tell arterioles away from the other one, the other main type, which is venous, the venous tree, or venules if they're small, and veins if they're big, and you can tell them apart because due to the thickness of the wall. The arterioles will have a thicker wall, with that will contain smooth muscle in it, which allows them to contract to maintain blood pressure, and they operate under higher pressure, the arterial system, whereas veins operate in low pressure and have thinner walls. So this is a vein here because this has got a thin wall, and this is an artery here because it's got a thicker wall, and I can tell that these are definitely blood vessels because these are full of erythrocytes, and also they're lined by endothelium, which is the specific type of single cell layered lining that lines the entire vascular network. It lines the heart, it lines the veins, it lines the arteries, and it's like these elongated cells here. These are the nuclei I'm pointing out because they're stained with hematoxylin. But either side of the nuclei, you can see some pink cytoplasm, and that's forming. These are forming tight junctions to seal off the lumen of the of the vessel, to keep all the intravascular components inside here, not from spilling out. And then the wall is composed of smooth muscle cells and other cells. We're going to go into this in more detail probably a bit later, but suffice it to say, these are blood vessels. That'll do for the moment. So if we kind of look around, I think we've identified all the tissue types here. There's probably one thing here that I've not talked about. This is because this is not normal, so I'm ignoring this for now. This is all the normal stuff. This is skin with it. This is a basal cell carcinoma, and it looks quite different from this. I think this stuff is the normal stuff, and that stuff is the tumor. I'm ignoring that for now. But if we just look at this component, we've pretty much identified everything on the slide here. So up at the top, we've got our epidermis, which is a form of epithelium. It's keratinizing on the surface, keratinizing stratified squamous epithelium. So that's the epidermis. We've got the modified epidermis coming to here. This is the hair follicle. We've got this glandular epithelium here. This is the sebaceous glands. We've got more glandular epithelium here. This is a sweat gland. In between all this stuff, we've got the connective tissue, which is made of, our collagen and our elastin and our fibroblasts, and that's forming all this stuff. Down here, we've got our clear material. That's this is the adipose tissue made of adipocytes or fat cells. Down here, right at the bottom here, we've got our skeletal muscle. Over here, we've got our collection of chronic inflammatory cells. We didn't really come across good examples of acute inflammatory cells or neutrophils here in this section, which is a bit unfortunate, but I'll come to I'll go and find a GI biopsy for you so we can look at that in a second. And we've got our blood vessels with our erythrocytes in them, and that's pretty much, I think we've pretty much covered everything in this slide, and that really covers the main tissue types: the epithelium, the blood, muscle, neural tissue, and connective tissue. Hello, I just wanted to show you a section. This is a normal colonic section. We're going to go to this in more detail in a later video, but I wanted to show you a couple of things that you couldn't really see good examples of in the skin, but is obvious in a normal colon section. The first is this stuff. So this is muscularis propria of the colon, which is made of smooth muscle cells. So these are really good examples of smooth muscle cells. So smooth muscle, in contrast with skeletal muscle, the nuclei, the cells are much smaller for a start, and the nuclei are centrally placed with not off to one side, and these are the good examples of the nuclei. They are blunt-ended, cigar-shaped. So they're a wee bit like fibroblasts, but they don't taper off to either end in the same way. They are blunt-ended, resemble cigars, and they're surrounded by pink cytoplasm. And these are the nuclei are placed in the central of the cell. They don't have the cross striations. They're not nearly as big. Nuclei are central, and these are all smooth muscle cells. It's quite easy to identify them when they're side on like this. When you cut through them in a cross section, sometimes they can look a bit less obvious. This just looks like round nuclei and pink cytoplasm. So what you want to do is look around, find a section that's got that they're sidelong, and it's quite easy to identify. Nothing really looks like that. Fibroblasts can look a bit similar, but they don't tend to have the blunt-ended nuclei. So that's smooth muscle cells. Second thing I wanted to show you was there was a cell that we couldn't see in the skin that I wanted to show you. It's another blood constituent cell, and they're not present normally in skin, but they are in colonic biopsy, and that's these cells, these bright pink cells, and these are cells called eosinophils. Eosinophils are eosinophilic, intensely pink, hence the name, and they're a granulocyte. They've got this intensely pink granular cytoplasm, just these little granules which pick up intense eosinophil staining, and they often you can see sometimes a bilobed nucleus. Not easy to see here, to be honest. Maybe that's 2 lobes in that one. They can look a wee bit like neutrophils, but they're just discriminated. They don't have the 3 lobes of a neutrophil, and the neutrophil has this pink cytoplasm that looks a bit more like this sort of shade, but eosinophils have this bright, almost red, bright granular cytoplasm, and that's how you tell those apart. So that's eosinophils. So, and the one last thing, we didn't have really good examples of blood vessels in the skin, but here's we've got this. This is a really good example of an artery, where we can see erythrocytes in the center, which I can identify easily by their concave shape, absence of a nucleus, and that's what they are, loads of erythrocytes. But lining this, so this is the lumen of the blood vessel. Lining the lumen of the blood vessel are these elongated, single cell layer, elongated, I don't know how easy, yeah, here's one, elongated endothelial cells. That's the nucleus. This is the cytoplasm. That's the nucleus. Cytoplasm. Here's another nucleus, and they're forming tight junctions, sealing off the lumen. And that is the arterial walls are separated into 3 layers, and this is the intima, so the internal layer, which is just formed of endothelium. Underneath that, there's a wee bit of basement membrane, and there might be a wee bit of tiny wee bit of connective tissue underneath that. Maybe more obvious here. I think there's a wee bit of intima there, and then there's a very thin layer of elastin called the internal elastic lamina. Underneath that, there's a variable thickness media, which is made of, again, smooth muscle cells. So these are the same cells. So you can see the blunt-ended cigar-shaped nucleus. So this is smooth muscle cells. And then there's another external elastic lamina beyond that band of muscle. Here, that's that wavy stuff, is the external elastic lamina. And then beyond that is connective tissue called adventitia, and that's what all arteries will have, those three layers. And that's just a much better example of an artery. It's a nice big one to show you, and that's all right. I'll just quickly show you another skin section of a melanoma to demonstrate the last couple of points, and then we're done. This is a different tissue section. Again, it's from skin, and this is completely pathological. This is actually a section from melanoma, but this I wanted to show you two things from this, really. We'll ignore the melanoma for now, and I wanted to show you two things. The first was we couldn't find a good example of a neutrophil in the last section, but there's actually lots of neutrophils in here. There's lots of acute inflammation, and these are like most of the cells here are actually neutrophils. So what we're looking for in a neutrophil is the trilobed nucleus. See if we can get a good example. So in this field, we've got a few that are probably reasonable examples. Here's one. This is one cell, and this nucleus has got the 3 lobes to it. This is 1, this is 2, this is 3. And you can see this nucleus because it's picking up the hematoxylin stain. It's looking purple. And it's got 3 lobes. Remember, this is a 2D section through a 3D structure. You might not always get all 3 in the plane of section, so you might just see 2. But here, look, if we look here, like here's a cell. It's got the 3 lobes, 1, 2, 3, and actually this has the Mickey Mouse look. So it's like Mickey's face here with the 2 ears, and then it's got a little bit of pink cytoplasm round about it. Here's another neutrophil, but it's difficult to actually appreciate the 3 lobes. This is 1, this is 2. That could be the third, who knows? And we've got a bit of pink cytoplasm round about it. And here's another one. This is a really good Mickey Mouse looking one, actually. 1, 2, 3 lobes, and that's what neutrophils look like. So these are all neutrophils. So this is another example. We've got a bit of pink cytoplasm, and 1, 2, 3 lobes of nucleus. So these are all, or a lot of these cells are neutrophils. And here we've got our friends, the erythrocyte here, as you can tell, because it's just these cells are just taking up eosin, and they have that concave look to them. So there's erythrocytes, and that was one of the things. The other thing is this is pathological, but this is a good way of showing something that happens pathologically, but also physiologically. So obviously cells are living, they only have a certain lifespan. And within that lifespan, it starts with a cell dividing through mitosis, and it ends with them dying through programmed cell death or apoptosis. This has accelerated that process here because this is a melanoma. These cells are replicating far too quickly. What it does mean we can have a good show some good examples of mitosis. So mitosis, cells go through different phases within mitosis. So there's prophase, metaphase, anaphase, and telophase, and you can catch cells at all the different phases. And I suggest you just go and look that up in a book, and you can, if you need to refresh your memory of those. But essentially, through these phases, you get condensation of chromatin. The cell loses its normal nuclear anatomy, normal nuclear outline, and you can just see the clumped chromatin. So if we look here, this is an example of that. So the chromatin's all clumped up and lined up in the center of the cell. So that's, if I remember rightly, is the metaphase, where the chromatin, here's another example, lines up in the middle of the cell before it splits in two and goes to either end of the cell, which is the anaphase. We'll have a look around to see if we can get an example of that. This is another example of a cell dividing, so the chromatin is kind of formed that kind of fluffy, spiky, kind of condensed appearance, and you can't see a nucleus here, you can just see the chromatin with that look. We'll look around more. There's more of these, more examples of this. This is a slightly more difficult example to appreciate. Here's some more. There's that kind of fluffy, spiky chromatin look. You can't see the nucleus. Here's another example. Here's another example. Here's another example. So that's what it looks like when cells are dividing. Yeah, so the other thing I wanted to show you was what happens when cells die. So in programmed cell death, the nucleus becomes condensed, what they call pycnotic, really can sometimes look really intensely dark like this one, and the cytoplasm becomes intensely pink. So it's just, that's an apoptotic cell. So we've got condensed nuclear material here in the center, and intensely pink cytoplasm around about it. Here's it. Maybe this is further along in that process. The nucleus is very pycnotic, very small, round, and we've got densely eosinophilic cytoplasm round about it. Same for this one. There's quite a lot of dying cells, quite a lot of cell death going on here. That there's maybe another example there. Here's another example here. Here's another example here, where the cells become very small, darkly staining, intensely eosinophilic cytoplasm, and that's called apoptosis or programmed cell death, and that's physiological, but in this case it's happening pathological. Pathologically, there's too much cell turnover here, and that's really all I wanted to show you from this slide for now. So that rounds off this introduction to pathology. Hopefully you got enough out of that so that you can recognize the main cell types, the main tissue types. You can orientate yourself, you know roughly what you're looking at. I suggest you go away and have a wee look at your own slides and try and identify some of these cell types on your own. Just get a feel for the range of appearances, and it's really good to have a good foundation of what normal looks like and what cells look like before you start recognizing what abnormal looks like. So I've got a few videos coming up which I'll go through quickly through the various tissue types, and we'll describe how they look under normal conditions, so that then you've got a baseline for going forward and identifying how they look in pathological situations. Okay, speak to you soon.